So thank you everyone for coming to the virtual health research seminar series here at CMHS IIM Ahmedabad. Today we have with us Professor Ritwik Banerjee from IIM Bangalore talking with us his recent paper on exponential growth bias in the prediction of COVID-19 spread and economic expectations, joint work with Priyama Majumdar from University of Warwick. Over to you, Ritwik.
Yeah. Thank you very much, Professor Chatterjee, for having me. This is a pleasure to be able to give this talk. And we've been working through the summer on exponential growth bias in the context of COVID-19. And this is the first time I'm getting to present, in fact, not one, but a summary of 3 papers that we have been working on. But I'll focus on the paper which is on the title, which is Exponential Growth Bias in the Prediction of COVID-19 Spread and Economic Expectations. So it's a great time to get some comments and improve upon the work that we've already done. So this paper is joint work with Priyama Majumdar, who is heading to University of Warwick for her PhD. As I go along, I'll also introduce 2 other co-authors of mine who has worked with me in the domain of exponential growth bias. So here is a first question that I want you to sort of engage in as viewers. I'm not sure. So I was kind of unsure about the format. So I was under the impression that there could be interactions. So this slide is there and then so that you guys can interact with me in some sense. So the question is, total number of COVID-19 cases in India on the 1st of May 2020 was 35,000. Total number of cases on 1st of June 2020 in India was 1,90,000. What is the total number of COVID-19 cases on 1st of August 2020? So that's the question I had for you. So take 10 seconds to think through what that number could be. If you have a chat box, feel free to just type it down. So if you've thought through what the number is, stay put with it, because the correct number of cases was more than 16 lakhs or 1.6 or nearly 1.7 million, right? So this goes on to show the exponential nature of the growth rate of the coronavirus total number of cases curve. Turns out that we humans, we are not really very adept at predicting data which follows the data which essentially follows an exponential growth path, and that is well captured in this famous, or rather legend of Sissa ibn Dahid, who apparently was the inventor of Chaturanga, which happens to be the precursor of chess. And the king was very happy that this kind of a very intelligent game was discovered by Sissa ibn Dahid, and asked him, what do you want? What do you want as a gift for having invented this great game? So he apparently said, I want you to put 1 grain of rice on the first square, 2 on the second, 4 on the third, and so on and so forth. So the king was very amused at this proposal and immediately granted him the entire gift. Did not realize that by the time the number of grains would reach the 64th cell or box, that the amount, the worth of that amount of grain would be more than his entire kingdom. So clearly the king did not foresee the nature of the growth path of the grains that were there, that he demanded or he wanted as reward on the chess board, right? So what is exponential growth bias? Well, exponential growth bias is this pervasive tendency to linearize exponential functions when assessing them intuitively, right? So given a present value, there is a tendency in us to kind of underestimate the future value. And that captures the essence of exponential growth bias. So what are some of the common examples of exponential growth bias? Well, many of you may have experienced milk spilling over while boiling, and you were right there in front of the stove, right? So what happened? Why did the milk spill over? Well, the reason is the boiling rate of the milk or the rate of increase in the volume of the milk follows an exponential growth path. So even if we are in front of the stove, we don't quite have a sense of when it will spill over because the rate is exponential in nature, right? There could be other examples, other applications where exponential growth bias could play a very important role. So think of a setup where a city planner is kind of planning the amount of roads and facilities that a city should have 50 years down the line, right? Routinely, we observe, particularly in less developed countries where city planning is not really taught and practiced scientifically, the 50 years down the line, we are horribly short of roads. So what happened? Policymakers generally tend to sort of discount the growth of traffic 10 years down the line, 20 years down the line, and certainly 50 years down. The implication is the planning that happens today is quite inadequate for the level of traffic that the city would, for example, see 50 years down the line. Okay, so there have been some research about exponential growth bias, particularly in psychology. So there were interest in exponential growth bias from the psychological standpoint, and then economists they kind of took it over somewhere around in late 2000, right? The most important paper in this regard is one by Stango and Zinman, who show that people who have exponential growth bias, they end up with lower levels of savings and increased borrowings. So why do they end up with lower levels of savings and increased borrowings? Well, if people have EGB, then they don't quite see the level at which their debt would grow 10 years down the line or 20 years down the line. So they have this tendency to lower or the perceived debt level in the future is much lower than their actual debt levels. As a result, they feel much more comfortable in borrowing. Their savings rate is generally lower, and so on and so forth. So that's the Journal of Finance paper by Stango and Zinman, right? Later on, there were papers which showed that people have difficulty in compounding interest rates, right? Think of the king. The king had difficulty in understanding the amount of grains that would accrue on the 64 box. That essentially is a problem that's kind of reflects the inability on the part of the king to predict or failure on the part of the king to compound interest rate. So the question that we are kind of interested in is, do people exhibit exponential growth bias in predicting the number of COVID-19 cases? What are the consequences of exponential growth bias in the context of COVID-19 cases? And can we kind of nudge people to reduce this EGB? What are the consequences of nudging people to reduce EGB? So this is like the big picture question that we are kind of interested in, and we answered this question in three different papers. So here is a brief snapshot of the growth rate of the growth of the disease in the US. So the figure on the left that you see here is the data from US, right? And that on the right is the data from India. Clearly in the US, there is substantial convexity. In India, of course, the curve looks very much more directly exponential. So this is kind of the first snapshot that, yes, we're dealing with a data generating process, which is very much exponential in nature, which is convex more generally, and in many cases exponential, right? So we have 3 papers having documented the evidence of exponential nature of the growth path. We have 3 papers to study different aspects and consequences and so on. The first one is a joint with Joydeep Bhattacharya and Priyoma. Joydeep is at ISU. And I'll quickly give you a snapshot of what this paper is about going forward, and then move on to the main paper that I want to discuss, which is exponential growth bias in the prediction of COVID-19 spread and economic expectation. Again, joint work with Priyoma Majumdar. And then quickly give you a brief summary of the third paper, which is the role of nudges in reducing exponential growth bias and increasing the safety compliance in COVID times. So this is joint work with Priyoma and Shatarupa Mitro, who happens to be a PhD student here at IIM Bangalore. So this is let's quickly talk about the first paper. So what are the key questions we're trying to answer in the first paper? So the first is, we want to document that people indeed, right, exhibit EGB in the context of predicting the number of COVID-19 cases in the future. So that's the most important question, and kind of brings novelty in the literature. So now there is a literature on COVID-19, economics of COVID-19. There's a journal also called COVID Economics. So that's the first contribution to COVID economics, if you will. The second key question that we want to ask is, does EGB predict lack of compliance to the WHO safety norms, such as wearing masks, social distancing, etc., etc. Now, what is the intuition? Why are we kind of interested in EGB and the role of EGB in predicting compliance to the WHO safety norms? Now, think of it. Think of a biased person who thinks the number of cases in the future will be lower than the actual number, right? That's what the bias is all about. The actual number is much higher. My prediction is much lower. So think of a person like that. And so what is going on in his mind? If this person thinks that the number of cases will be lower than actual, then the risk perception in the mind of this person about the future will also be much lower, right? What does it mean in terms of compliance? If I think there isn't much of a risk in the future about COVID infection, then I'm less likely to comply, right? I'm less likely to comply. I'm less likely to maintain social distance, wear masks, practice the safety, use sanitizers, for example, all of that. So we wanted to understand if EGB predicts lack of compliance to these standard WHO safety norms. A very important question from the public health standpoint. The third question we're trying to understand is also interesting in our view. And for that, a little bit of a precursor, the study was conducted on March 21st, 2020. And on this date, different countries were at different stages of the pandemic, right? So India had about 200 or 400 such cases, I think, at that time. So different countries were at different stages at that time. So the question we were interested in asking was, do people from advanced stage countries exhibit lower EGB than those from late stage countries, right? Now, there could be several interesting things going on here. So think of a person who has already seen a lot of the growth curve. Does learning happen? Does a person in advanced stage country kind of exhibit lower EGB because the person has learned what the nature of the growth path is? That was a prior we started off with. I'll tell you what our findings were in a bit, right? So we conducted an experiment on Amazon MDoc. I'll come to the platform in a bit. So we had data from 4 different countries: Germany, US, France, and Spain. And each person in the experiment had to perform 4 tasks. 2 countries out of the 4 were picked, right? And data obtained from these countries range from early phases of the COVID-19 spread as well as the later phases of the COVID-19 spread. right? And we made sure that we did not pick a country to which a person belonged. Why is that important? That's kind of important because people may have all kinds of different beliefs about the country they're living in, right? So we did not want them or their prior information to contaminate their prediction task. So 2 countries, early and later phases for each of the 2 countries picked, that gives us 4 tasks. And an individual essentially predicts the number of future cases in each of these 4 tasks. So what does a task look like? Now, people were shown data on so we took the data series and we converted them into, into several weeks. So people were shown data from week 1, week 2, and week 3, right? And they were simply asked, what do you think is the number of cases on week 4? What do you think is the number of cases on week 5? So 2 of these tasks were randomly picked, and as is the practice, the participants were paid an incentive for correct prediction, and 25 cents were paid if the prediction was within 5% of the actual number. Just to give you a sense of what I'm really talking about, these are the data points we gave them. It doesn't look like exponential here, but it is exponential, trust me, because the range here is too much, is too wide. And so this is the early phase, and in later phases, we gave these three data points, asked them to predict 4 and 5. So in this case, we asked them to predict 4 and 5. So that's the nature of the task, generic task. So let me know if you have questions. I'm kind of happy to stop and clarify your questions. But maybe
so Ritwik, I had a question.
Yeah.
So suppose these numbers that you are giving or countries are reporting are problematic in that people know somehow, not with seroprevalence tests, but generally that there's a lot of prevalence, asymptomatics are hard, and as a result, the linearization that you are saying is coming from that understanding rather than the risk-taking mechanism. How do you control for that aspect in your analysis?
Right. So that's a very important question. So that's exactly why we had 4 different tasks belonging to 4 countries. The countries were not pre-announced, like the names of the countries were not revealed. So they had no idea about whether it was Germany, US, France, Spain. So we kind of have external validity because we are talking about different countries and prediction bias arising in all of these different countries, no prior about the administrative efficiency of these countries, etc., etc. So that's one. The second is randomization, right? So going forward, I'll show you that people are randomly seeing different kind of information, and the treatment effects kind of wash out the kind of errors that you are talking about, the reporting errors that you are talking about, the lack of testing, the inefficiencies of the data collection mechanism, etc., etc.
Okay, thanks. Others, if you have questions, please plug them into the chat box. You can go ahead, Ritwik.
Yeah. So participants predict the number of cases in 4 such tasks. Following the predictions, they write a short survey, and the survey comprised of 2 broad categories. One is a measure of compliance indices, which was created from data on actual realized compliance, which kind of asks to what extent does a participant observe the safety protocol, right? So we had questions on that. Do you wear face mask when you go out? Do you avoid go out? Do you maintain social distancing, etc.? So we have their stated preference for compliance. The second index that we created was appropriateness of violation of safety norms. How appropriate does a subject think that a violation of a safety norm is? So for example, you observe your neighbor kind of not observing some of these safety norms. So how appropriate do you think that behavior is? So we have an index on appropriate, or this is a sense of my perception of what is morally the right thing to do under the circumstances as observed by others. And the second is agreeableness with the government performance. How satisfied is the subject with the government's handling of the COVID crisis? And then we elicited some data on the demographics. So the experiment was conducted on Amazon MTurk with participants from over 43 countries. They belong to three different stages. So we categorized stage 1 countries as those which had less than 100 cases as of 21st March. Some of these countries were Bangladesh, New Zealand, which eventually did very well in containing the pandemic, and South Africa. Stage 2 countries were those which, as on 21st March, had between 100 and 999 subjects, 99 confirmed cases. And these countries included India, Pakistan, Turkey. Stage 3 countries were those which had more than 999 cases, as on 21st March, US, Brazil, Germany, some examples, right? So this decision-making game or prediction task was coded up on O3, and each session lasted for about 15 to 20 minutes. A participation fee of 55 cents were given to the MTurkers, in addition to the incentive earning that they would get from the prediction task, right? Quickly, the results. These were the data which were provided, right? And this is what the prediction looks like. These red diamonds that you see, these are the median predictions. So this is what the median prediction is for week 4, and this is what the median prediction is for week 5. For the early phase, we had a similar, the pattern was pretty much similar in the context of the later phases. What was the actual data? The actual data was this, right? So you can clearly see there's a large prediction error in week 4, and there is an even large prediction error in week 5. This we call is EGB, appropriately defined. So how do we transform this prediction error to a normalized bias? We transformed the prediction error in the following way. The bias in week 4 with respect to week 3 is given by the prediction error, the raw prediction error, normalized by the total amount of error that one could possibly make, right? So what is the difference between a week 3 number and week 4 number? That's the denominator. And what is the prediction error? That's the numerator. So that's our normalized measure of bias in week 4 with respect to week 3. Similarly, we have a normalized measure of bias in week 5 with respect to week 3. And finally, we have an average bias, which is essentially an average of bias 4.3 and bias 5.3. Right?
So are there diminishing demonstration of this bias over time? Like, how do we think about time? You talked about the king learning that after 64 grains of rice that the kingdom is sold. So, I mean, sorry, go ahead.
If anything, this bias is actually increasing over time. And I'll show you other evidences in the next paper as well. With the size of the bias higher as we go forward. So this is bias 4.3 and bias 5.3 averaged over the later and early phases, right? It's very significantly different from 0. The median bias 4.3 is about 0.43, significantly different from 0 at the 1% level. Median bias 5.3 is 0.46. again, significantly different from 0 at the 1% level. And the average bias is 0.44, again, significantly different from 0 at the 1% level. So the first result, the important result, is exponential growth bias, however measured, is positive and significantly different from 0. So how do the biases correlate with the stages? Remember, we can't say anything causal about the association between stages and EGB, right? So we just have some correlations here. So so what we did was we regressed the EGB on different stages and compared stage 2 with respect to stage 1, stage 3 with respect to stage 1, stage 3 with respect to stage 2. And it turns out that quite consistently, stage 3 bias is greater than the bias in stage 1. So that's the result I'm talking about. The stage 3 bias is significantly higher than the stage 1 bias. And that is why you see this positive coefficient here. You see that for bias 4.3, you see that for bias 5.3, as well as for average bias. We also measured an unincentivized own country bias in future prediction, and that also turns out to be positive and significant, which means that the later stage countries actually end up exhibiting greater bias, right, than early stage countries. Now, remember, when I motivated this question, I kind of hinted that people will learn the exponential growth rate process, will learn the nature of the growth path of the disease, and they may actually be able to, they may actually be able to give a more correct or accurate number for the future. Turns out it's exactly the opposite. Why do we see that? Well, we have some suggestive evidence of why we see that in the paper, and we call it a behavioral, we call it a behavioral fatigue. What is behavioral fatigue? Behavioral fatigue is this thing where people kind of get tired of observing very stringent quarantine practices. So that's one evidence, or that's one way in which behavioral fatigue can play out. And we show in the paper that not only do the later stage countries exhibit greater bias, they also have lower information about the current number of cases. So we ask them, what do you think is the current number of cases in your own country? Turns out that later stage countries, people are less aware of what the number of cases at that time is. And anecdotally, I've kind of seen this, that initially I was quite interested in knowing what the number of cases are. Today, not anymore. That can be one suggestive. Again, we don't have a very precise causal mechanism to kind of explain what is going on here, but some suggestive evidence that behavioral fatigue or caution fatigue may be one way in which this result can be rationalized.
Ritwik, there is a question from Ashu Arora, who is saying that, has this bias of participants anything to do with their educational background, access to sufficient information, income level, or any other socioeconomic factor?
Right. So this is a very important question. In general, there is a debate in the literature about what the, whether education reduces a bias of this kind or not. In our sample, we do not find evidence of either gender or education levels increasing or decreasing. So there is no association between education level and bias in our sample. But we are aware that it is possible that more education can reduce the bias. It is possible, but we don't find evidence for that in our data.
Got it.
So here is the main result of the paper. We find
Pallavi has a, sorry, I didn't want to stop you, but Pallavi has a question of, do you also study the welfare consequences of this bias?
Yeah, so this is a this is, I don't know whether Pallavi was a referee for this paper or not, but this was one of the questions raised by a referee. But our response is, if so, we've shown, in the second paper, I'll go more in a greater detail about what the consequences of not really welfare, but what the consequences of not observing bias could be. But a simple association shows higher bias, lower compliance. The welfare effects are very easy to kind of intuitively see. Lower compliance meaning, greater personal risk of infecting oneself with COVID. It also means greater communal spread. So the welfare consequences are pretty high. But we don't have a number to that. We can't sort of say that, reducing bias by 1 percentage point can increase welfare by XX percentage point. We can't say that. But we can, we can intuitively point at the welfare consequences more qualitatively.
So Ritwik, I have an idea for you here. It may help you. You can measure the elasticity of masking with respect to the bias.
Mm-hmm.
And there are estimates out there now which show how much masking benefits the macroeconomy. I think from JP Morgan, there is a study or something like that. So you can use that elasticity measure on that number to actually say, okay, the welfare effects macroeconomically may be that much. I'll send you this offline.
Absolutely, that would be fantastic. In fact, we were missing exactly that piece of the puzzle. If 1 percentage point people are more likely to wear safety, masks, then what does it mean in terms of the spread of the disease? Exactly. And then what does that mean in terms of the macroeconomy? So these are two pieces of that puzzle which we were kind of missing.
Yeah, I'll send you that on an email.
So this is kind of the main result, bias and compliance. And you see that we have 3 different measures of compliance, right? And once again, this is a stated compliance measure. We don't observe the actual compliance. Right? So this is a stated measure, and we have 3 different measures. One is the actual realized compliance. Another is the appropriateness of violation of the safety norms. And the other is agreeableness with government performance. And as you can see, the point estimates are negative and significant at the 10% level. So far as bias of week 5 with respect to 3 is concerned, for actual realized compliance, the point estimates here are kind of borderline significant with the set of controls. It's significant at the 10% level. We do not observe significance at the 5% level, and appropriateness of violation of safety norms is positive and significant at the 1% level for bias 4.3 and average bias. It is significant at the 5% level for bias 5.3. So this kind of indicates that higher the bias, right, more does a person find it appropriate, find violation of safety norms as appropriate. So that would be the kind of interpretation. And we also observe a very strong results for agreeableness with the government performance, and we observe, and the coefficients here are positive and significant at the 5% level too, and it kind of shows that people who have higher bias, they tend to agree with the government part. They tend to say that governments have done a reasonably good job so far as tackling COVID-19 is concerned, right? So now that has some long-term consequences, which of course we are not able to measure, but it is quite easy to see. A biased person will demand less from the government, will be more satisfied with the government performance, so to say. And that in turn will mean the demand from the government, from the citizenry, which is affected by EGB, will be lower than otherwise. So that's the key result that we had in paper 1. We documented EGB and showed that EGB is correlated with lower safety compliance norms. But there are a few other questions, right, which remain unanswered. So the first is, now we have documented bias, so what do we do about it, right? Can we devise some simple mechanisms through which we can reduce the exponential growth bias? So that's the first question. Now think of this, if an intervention decreases EGB, right? If an intervention is successful at decreasing the bias, then it is likely to increase the risk perception with regard to COVID-19 spread, right? So I'm now lower, so I have been through a treatment, I've been through an intervention. I now think that the risk of catching an infection is higher because I've been treated. So the question is, what does this increased risk perception imply about perception about the economy? What do I think will be the consequences for the macroeconomy when I'm treated of this bias? So that's the first question. The second question is, if I am treated, what do I think about the risk of contracting COVID-19? In other words, am I more likely to be, a treated person, is he more likely to comply with the safety norms? So we tackle the first set of questions related to the economy in the second paper, and the second set of questions related to compliance behavior in the third paper. So what I'll do in this presentation is go through the experimental design of paper 2 in some detail, and then quickly leave you with the results that we find in paper 3. Okay, so this is the second paper. This is what the title of the presentation is: Exponential Growth Bias in the Prediction of COVID-19 Spread and Economic Expectation, joint work with Prioma and So the literature on EGB in economics kind of does focus on a bunch of finance-related applications. So as I discussed earlier, Stango and Zinman, they show that that individuals who have EGP have lower savings, increased borrowings, and so on. Levy and Tassoff in their GIA paper in 2016 show that EGB is causally associated with less asset accumulation, and I discussed what the underlying mechanism could be. Now we study the perception or expectation about the macroeconomy and the personal circumstances in the context of EGB. Now, why is it important to study the macroeconomic expectations? Because there is a large literature now which kind of documents that macro expectations have an implication on one's economic choices and decisions, right? So pessimistic macroeconomic outlook decreases planned consumption, as has been found by Roth and Wohlfahrt in their 2019 paper, which is now forthcoming in Review of Economics and Statistics. Others have found that pessimistic macro outlook can lead to lower investment in stock markets. So if I think that the future is bleak, I'm less likely to kind of invest in the stock market. Of course, there's a very large literature on inflation expectation and what implication it has on spending and a whole range of other outcomes. Bachman 2015 is a recent example of that. Other potential channels, if I think that the future is bleak, then I'm probably going to increase my precautionary savings for the future, as opposed to, my perception, future looks great, optimism, I may lower my precautionary savings, so on. So macro expectations have some real consequences so far as actual economic choices are concerned. This is something we don't establish in our paper, but we kind of rely on the literature for that piece of the puzzle. So we answered 3 allied questions. Question 1, do simple behaviorally informed nudges help reduce/eliminate EGB? So that's the first question. The second question is, do behavioral policy interventions that help reduce EGP also rationalize economic expectations about the future of the macroeconomy, and expectation about one's own personal economic circumstances? And the third question is, what is the mechanism through which nudges affect economic outcomes, if at all? The answer to question 1 and 2 are yes. So these are the three broad questions that we try to answer in this paper. So once again, you know the design by now. We follow that canonical kind of a design, and with a little bit of a twist, as I'll explain very quickly. So this is what the baseline looks like. Participants see the number of COVID-19 cases in some country W for days 0, 5, and 10. Mind you, this is a real country. The data is real. We are not indulging in deceiving the experimental subjects. So no, this is a deception-free experiment, right? There is a real country. It's only that the people don't get to know the real country. They only get to know that this is data from some country which is W. Okay? So they see data, and then they move on to the first stage, which is the prediction task, where they have to predict the number of cases for the future. So in the baseline, they see data for 0, 5, and 10th day, and they have to predict the number of cases for day 35, right? There's a 50 cents reward if the predicted number is within the 5% of the actual number. So that's a prediction task. After having predicted the number of cases, they move on to the second stage, which comprises of the investment task. Very simple. Participants are given an endowment of 50 cents to invest in the stock market, right? In the stock market of the country W, and the returns to the investment are truthfully determined on the basis of the stock market performance on day 35 relative to day 10, right? So where is the stock market on day 35 relative to day 10? Depending on that, the returns are calculated, and the investment is kind of rewarded with the return, with that particular return. Following the investment task, they move on to the survey section, where they reveal their economic expectations. I'll come in a minute to what these economic expectation variables are, and there is a short demographic survey at the end. How much time do I have, Chirantan?
15 more minutes.
15 more minutes. Okay, that should be fine. So that's the baseline, right? The first intervention we wanted to try out was the step intervention. So remember, in the previous case, the participants, they saw data for 0, 5, and 10th day, and they had to predict for day 35. In the step treatment, they see data for 0, 5, and 10th day, but they predict for day 15. In stage 1 of day 15, they invest for day 20 in stage 2 of day 15. So they're not directly predicting for day 35. They're predicting and investing on day 15. And this is repeated for days 20, 25, 30, and 35. In other words, the participants, they predict in shorter steps, right? Everything in the step treatment is the same as in the baseline, except that they have several shorter steps to kind of invest in, predict and invest in. The second treatment is the experimental design treatment. So we took the step treatment as a second baseline, and this is the crucial difference in the feedback number treatment with respect to baseline. So on day 15, participants are given a feedback about the prediction error that they had just, they predicted, they are immediately after their prediction, they are told that, look, you predicted this and this is your prediction error. So this is what it looks like. The actual number of cases was this, and your prediction of the total number of cases is this. Your prediction is more or less than the actual number by this amount, right? So they're given feedback in the form of numbers, feedback about the prediction errors in the form of numbers in the feedback number treatment. In the feedback graph treatment, they're given feedback in the form of graphs. So this is what they see. And in the graph treatment, it is much clearer what the nature of the exponential growth path is, what the nature of the spread of the disease is, right? So they receive feedback in terms of the graph. And they are again told that, look, your prediction was this, and you had committed, you had the error, prediction error for this day was that. In the feedback forecast treatment, we tried something else. So we thought that, look, government at its disposal has many epidemiologists and forecasters and specialists on the fort, right? So why doesn't the government ask a set of experts to forecast the number of COVID-19 cases of the future? And we can give people the forecasted number on the basis of a statistical model and then ask them to predict. So we, of course, did not have at our disposal the set of specialists. So we fitted a very simple statistical model to forecast the number of cases in the future. And we offered our subjects our forecast, and we told them, look, this is what the forecast from a very simple model that we run is, you know, and what do you think your prediction is? So we gave them a range. So we gave them a range, for instance, this. And we told them, look, according to our model, this is what the range is. Now predict what the number of cases are, right? So in the forecast model, we think that the forecast model is kind of policy relevant because the government could have done that and ended up not doing it. We'll see what the implication of such a forecast is on bias. Our main outcome variables are, once again, bias I with respect to J, bias today with respect to 5 days back, right? So we have in that, we have bias 1510, bias 2015, bias 2520, and so on. One of our main outcome variable is bias 3510. You know, in the baseline treatment, we only see bias 3510, right? Because there are no 15s, 20s, and 25s. So this is one of our main outcome variables, and this happens to be the second important outcome variable for us in this paper, which essentially is an average of the 5 different period-wise bias. In addition, we have 4 different investments, right? Investment in period 35, 30, 25, and 20. And these are our other outcome variables. So far as economic expectations are concerned, we relied on RBI's consumer confidence survey to measure the current situation index and the future expectation index. And we relied on the Michigan Consumer Survey to develop 3 different biases, 3 different outcomes: growth, which looked at growth and unemployment expectations 6 months ahead, growth and unemployment expectation 12 months ahead, and income loss and job loss expectations 6 months ahead, and so on. So these were standard questions which are asked in the Michigan Consumer Survey. We adapted them in the Indian context. We had another question, which is the time job. It basically measures the expected time needed to get a job if the job is lost. Okay.
Ritwik, there are some questions. Can I ask them now, or you want to hold on to them?
Sure.
You want me to ask them now?
Yeah, please go ahead.
So Arvind Shroff asks that In slide number 20, I want to understand as to how the frequency of repetitions decided to be in a difference of 5 days.
Slide number 20.
Yeah, the repeat 20, 25, 30, 35. How did you decide 5 days? I think that's what his question was.
Um, you could do it for 7 days as well. So we don't have anything serious to, the 5-day interval is just a convenience. So in the previous paper, we studied the same problem with data across weeks. In this paper, we studied it with 5-day intervals. Yeah.
Okay, and he has a follow-up which says, also point number 2, the higher is the frequency of predictions, the feedback loop will statistically be more accurate. So why not prediction in closer intervals like 2 days or every day?
So we wanted to test exactly that. Does prediction in shorter intervals help reduce bias? So you could do it in 2 days as well. I'm sure the bias will be even lower. So this is something that has not been tested, right? So we wanted to test if prediction would be lower if the frequency of prediction error would be lower if the frequency of prediction was higher. But your intuition is absolutely correct.
So Ashu Arora asks why the investment task is also not based on prediction. That is to obtain the EGB relation between the number of cases and stock market money growth of 50 cents. Wouldn't that have shown their actual bias about how they predict the growth in the number of cases and how they predict the stock market performance, hence showing the biasness in the perception of economic performance? I'm not sure I understand this question, but
So let me just paraphrase. Maybe this is what was asked. So why do we have an investment task in the first place? So notice that the compliance questions that I talked about in the previous paper, they were simply attitudes, right? They were not actual incentivized, they're not actual behavior. So one way in which experimental economists kind of, they try to get at actual behavior is by having incentivized tasks. So we decided to throw in an incentivized investment task, which would capture their revealed preference or revealed attitude about the future of the economy, right? So investment task is not about an attitude. These economic expectation questions, which I'm going to talk about in a bit, or I just talked about, they are nothing but attitude. They could be cheap talk, right? But in incentivized investment task is not a cheap talk. There are real monetary consequences. So the understanding in experimental economics is people would take an incentivized task much more seriously than just an attitude question. So an investment task in our experimental design is an outcome, or the amount invested is an outcome which we are going to study.
okay, Chandan, you have a raised hand. You want to ask that question? Can we unmute Chandan, Mini? Or Chandan, if you want to put it down in the text, I think at the end he can take that questions. Go ahead, Ritwik. Let's finish it. Then we can come back to any residual questions.
Sure. Right. So again, experiment was conducted with an Indian sample this time on MTurk. We had about 701 participants responding to our survey, and the average payout was $1.90 for a 15 to 20 minute task. So this is what we gave them. These are the data points we gave them, right? And what does the baseline prediction data look like? This is what it looks like. This is what they predict to be the number of cases on day 35. What was the actual number on day 35? The actual number is given by this huge EGB. Okay. what about STEP? Does STEP help reduce the bias? So what we have plotted here is a prediction in the STEP treatment. So these are prediction in the STEP treatment on day 20, day 25, day 30. Our interest, of course, is to compare the day 35 in the STEP treatment with the day 35 prediction in the baseline treatment. Clearly, STEP has done slightly better, right, in reducing the bias, but way below the actual number. What about the other treatments? This is the actual growth path of the disease. The other treatments do significantly better in terms of reducing prediction error relative to STEPs as well. So they are, of course, they do way better than the baseline in reducing the prediction error, but they also reduce the prediction error significantly with respect to STEP. So our first result is EGB is lower in the feedback N and the feedback G treatment, feedback number and feedback graph, as well as the forecast treatment. Mind you, I don't have it written up on the slide, but even in the forecast treatment, which essentially is this red dot here, the EGB is significantly lower compared to STEP, right? And here you can see that while STEP does reduce the bias, so this is the bias 3510 in baseline. This is the bias 3510 in STEP. So the difference between these two are significant, as I'll show you in a bit. So this is still positive, the bias is still positive. However, in the feedback and forecast treatment, the bias is not significantly different from zero. Bias 3510 essentially is eliminated in the feedback N, feedback G, and the forecast treatments. So STEP does reduce bias, others, they eliminate bias. That's of course not true for average bias, because in average bias, mind you, people take time to learn. In the feedback treatment, for example, the initial level of biases were much higher, even though they were receiving feedback. Eventually it became zero. So average bias as measured in the feedback N, feedback G, and the forecast treatment is different from zero, right? But that essentially captures the fact that it takes time, as somebody was pointing out, it takes time for people to learn what the exact nature of the data generating process is. So a quick comparison of the treatment effects on bias. So this is comparison with respect to the baseline, and you can see that the bias is negative in STEP with respect to the baseline, which means that the bias is lower in STEP with respect to the baseline. The bias is lower in feedback N with respect to the baseline, and so on. So with respect to the baseline, all the treatments have lower EGB. With respect to STEP, it turns out that all these treatments, their coefficients are negative, which essentially means even compared to STEP, the three treatments are reasonably successful in reducing EGB when compared to STEP. Okay. The third result is investment when compared to the baseline is again negative. It seems what is going on is the treatment is reducing bias, right? And people now have a greater risk perception about the state of the economy, right? And they're investing less. What this means is the investment is lower in the STEP treatment when compared to baseline. The investment is lower in the feedback and forecast treatments with respect to the baseline, right? Not only that, when compared to STEP, the coefficients are negative and significant for feedback and forecast. What it essentially says is, even compared to STEP, the investment in the feedback and forecast treatments, where remember bias was eliminated, right? Even compared to STEP, the investments were lower. So the more you are able to make people aware of, of the true nature of the growth path, the more they kind of rationalize their investment, they lower their investment. What about economic expectation? I won't go through the gory detail in the graph, but you can take it from me that the economic expectations are about the future are much less optimistic once you correct for EGB, right? So once you correct for EGB, the future economic index is kind of negative when compared to baseline. They're also negative compared to STEP, which essentially says that people have a much lower economic expectation when they are treated for their EGB. The time taken, the perceived time taken to find a job is also higher once they're corrected for their EGB. In other words, once you treat a person with a suitably designed behavioral nudge, chances are high that their economic expectations will also be rationalized / corrected. We delve a little bit into the mechanism and we propose a two-step process through which treatments affect the economic expectations. We propose that in the first step, the treatment is kind of an IV which affects the bias, and in the second step, the predicted bias affects the outcome, and we show that this indeed is a mechanism at work. The predicted EGB is a significant predictor of investment and the economic expectation indices that we constructed. We go into detail about why the treatment in this case is a valid IV, so I won't get into the details regarding those. In summary, behaviorally informed nudges can help reduce exponential growth bias. And through a reduction in EGB, they can suitably, people in general can suitably adjust their economic expectations. Quickly, the summary of the third paper. The third paper is very similar. We have the same set of treatments. However, the set of outcomes is related to appropriateness of violation of the safety norms proposed by WHO and evaluation of the government. And we show that those whose EGB was corrected through the STEP feedback and forecast treatments, they find violation of safety norms significantly less appropriate. So these are negative coefficients, which basically says that people who have higher EGB now, because they're treated, right, they have a lower a lower sense of appropriateness of violation of some of the standard safety norms. Very interesting, and this is you may find particularly useful, is the fact that they were asked evaluate the performance of the state government and the central government in each of these treatments. Very interestingly, there is absolutely no effect on state government, but evaluation of the central government in the treated treated set of people, they're significantly lower. In other words, once their EGB is corrected, they now think that the central government is doing a much poorer job than in the baseline treatment. However, they do not think that the state governments are doing a poorer job. Kind of gives a signal that the onus of the COVID-19 spread and the associated issues, public policy issues surrounding it, seems to be with the states, with the central government in the minds of the people. They are unwilling to put the state government at the dock. They're much more likely to make the central government responsible for the level of the for the way things are being tackled in the context of COVID-19. Okay, so in conclusion, we think through these papers that there's a very important role for effective communication strategies, right? And we also think that the government, in fact, has failed. Think of something like the forecast treatment. A government could have easily found a set of people, a set of experts, epidemiologists who use complex mathematical models to predict the future, and could have given the Indian public a sense of where this disease was heading. That could have decreased the EGB in the population, would have had improved compliance, reduced spread of the disease, and prevented deaths. So more generally, the set of papers that we talked about today is a pitch towards a more behaviorally informed public policy. So that's all I have to say today in the context of EGB. Thanks a lot for attending the talk and for being a patient listener. Great questions. Please feel free to ask more questions if you have.
Awesome. So we are open for like 5 more minutes of questions. If everyone wants to put the questions in the Q&A window or on the chat window. Great paper. Great set of papers, Ritwik. Thank you for sharing the results with us.
Thank you.
It looks like we don't have any questions. So thank you again. I think we asked you questions along the way and you effectively dealt with them. So we are fine. Wish you all the best in producing these in journals, and thank you again for making time for CMHS.
Thank you.
All right. Bye-bye.